Hey everyone, welcome back to my channel. I'm Nurse Miriam and I'm so glad you're here. Listen, I know how stressful preparing for the NCLEX can be, especially when it comes to pharmacology. There are just so many medications to remember, but don't worry, I've got your back. In this video, I'll walk you through 5 powerful tips to boost your pharmacology confidence and help you pass the NCLEX on your first try. Let's dive in. Alright, let's jump right into tip number 1. Master the high-risk medications first. The NCLEX tests your knowledge of these medications that, if administered incorrectly, could cause serious harm. Focus on anticoagulants like warfarin and heparin, insulin and other antidiabetic drugs, cardiac medications like digoxin, narcotics like morphine, and chemotherapy agents. Instead of memorizing every medication, focus on these high alert drugs first. Know their indications, side effects, lab values, and antidotes. For example, the antidote for a warfarin overdose is vitamin K. Always ask yourself what would harm the patient if I give too much or too little. Thinking critically will help you remember the important stuff and keep your future patients safe. Let's move on to tip number 2, which is a real game changer. Understand medication classes, not just individual drugs. Instead of memorizing hundreds of drug names, group medications into classes. Medicines in the same class share similar characteristics. They have similar actions, side effects, and nursing considerations. For example, beta blockers like atenolol and metoprolol lower blood pressure. ACE inhibitors like lisinopril can cause a dry cough. Understanding drug classes helps you make educated guesses. Pay attention to drug prefixes and suffixes. The suffix pril indicates an ACE inhibitor. The suffix LOL indicates a beta blocker, and the suffix statin indicates a cholesterol-lowering agent. Alright, moving on to tip number 3. Memorize those life-saving antidotes. Now, the NCLEX wants to know that you can handle emergencies, especially when it comes to medication overdoses or toxicity. So, knowing your antidotes is absolutely crucial. Here's a quick list of must-know antidotes that you should commit to memory. Warfarin, its antidote is vitamin K. Heparin, its antidote is protamine sulfate. Opioids like morphine have an antidote, naloxone, also known as Narcan. Benzodiazepines like lorazepam, their antidote is flumazenil. Digoxin, its antidote is digoxin immune fab, also known as Digibind. Acetaminophen or Tylenol, its antidote is acetylcysteine, also known as Mucomyst. Now, I know that's a lot of information to remember, but here's a pro tip. Create flashcards. Write the drug on one side and its antidote on the other. Quiz yourself daily, multiple times a day, until these antidotes become second nature to you. Trust me, putting in the work now will pay off big time on exam day. Alright, let's move on to tip number 4, and this one's all about patient education and safety. Remember, pharmacology isn't just about knowing the medications themselves, it's about teaching your patients how to take those medications safely and effectively. And guess what? The NCLEX knows that too. You'll often see questions that focus on patient instructions. So, when you're studying a medication, ask yourself, what should the patient avoid while taking this medication? What are the important side effects they need to report to their doctor immediately? How and when should the medication be taken? Let's look at some examples. Patients taking warfarin need to avoid foods high in vitamin K, like leafy green vegetables. Why? Because vitamin K can interfere with the way warfarin works. Statins, which are cholesterol-lowering medications, are best taken at night and may cause muscle pain. Tetracycline antibiotics should not be taken with dairy products and can cause photosensitivity, so it's important to warn patients about sun exposure. Remember, my dear nurses, always prioritize safety and the prevention of complications when answering pharmacology questions on the NCLEX. And finally, tip number 5. Watch for common side effects and life-threatening reactions. The NCLEX often tests your ability to distinguish between side effects that are merely bothersome and those that are downright dangerous. Let's talk about some serious side effects that you should never ever ignore. Anaphylaxis. This is a severe, life-threatening allergic reaction that requires immediate medical attention. Angioedema. This is a serious swelling reaction that can occur with ACE inhibitors. Severe hypotension. This can occur with antihypertensive medications and can be life-threatening if not addressed promptly. Respiratory depression. This is a potentially fatal side effect of opioids, and it's why you need to know your antidote naloxone like the back of your hand. Ototoxicity. This refers to damage to the ears, specifically the inner ear or auditory nerve, and it can be caused by aminoglycoside antibiotics. Now, on the other hand, mild nausea or a headache might be expected side effects of some medications and may not require immediate intervention. Remember, my nursing friends, if your patient shows signs of airway compromise, a severe allergic reaction, or life-threatening arrhythmias, that is always your top priority and it requires immediate action. And there you have it, 5 powerful NCLEX pharmacology tips to help you rock that exam. Download free copy of the Ultimate NCLEX Study Guide from nursecareerblueprint.com. Let's do a quick recap. Number 1, master those high-risk medications first. Number 2, understand medication classes, not just individual drugs. Number 3, memorize those life-saving antidotes. Number 4, pay attention to patient education and safety. And number 5, watch for common side effects and life-threatening reactions. Now, I know pharmacology can seem overwhelming, but I want you to remember this. You don't have to be a pharmacist to ace the NCLEX. The NCLEX isn't trying to trick you. It's simply trying to assess whether you're a safe-thinking nurse who can protect your patients. So, take your studies one step at a time, trust in your preparation, and always, always, always prioritize your patient's safety first. You've got this, my nursing friends. I believe in you. Free resource. Ready to study smarter, not harder? Download your free Ultimate NCLEX Study Guide and more study resources at nursecareerblueprint.com. Do not forget to subscribe to our channel for great tips and resources for nursing, school success, and NCLEX success.